Okay, so welcome to today's webinar. Today we will talk about one of the very difficult disease in today's times, that is muscular dystrophy, especially Duchenne and Becker's muscular dystrophy, and the homeopathic approach in it. As you already know, DMD or Duchenne muscular dystrophy is a very severe dystrophy. It begins generally in boys and it can deteriorate very fast. It is very difficult, this disease, for the parents also. The main thing is ambulation, difficulty in walking, the emaciation, the muscle affection, the scoliosis. Pathophysiology of it is, you can understand that there is a gene dystrophy which is connected to the cytoskeletal of the protein complex that basically is affected. And there are different types of muscular dystrophy also that one should know. It's mostly X-linked recessive, and it causes due to a mutation actually. What are the main symptoms? It is a progressive neuromuscular disorder where there is muscle wasting. Voluntary muscles are more affected first: the hips, the pelvic area, thigh, shoulder, calves. Muscle weakness. Calf often is enlarged, and it often is diagnosed before age of 6. One of the things that you will see is awkward way of walking, frequent falling, fatigue, difficulty with motor skills, and lumbar hyperlordosis. There is a lot of contractures. Pseudo-hypertrophy of calf is also seen. Deformities can be very common. Also, there is a lot of ADHD, dyslexia, and these kind of symptoms. The main symptom on which we diagnose is, is a sign called as Gover's sign, where the patient finds it difficult to stand from sitting position. The posture becomes something like that. The shoulder, arms are drooped, sway in the back, weak butt, poor balance, weak muscles, tight heel, and so on. I told you about the Gover sign. This is where they find it very difficult to kind of stand from sitting position. One of the commonest tests to do it is CPK, and EMG is also done. There are many complex symptoms where the dystrophy affects the heart, etc. And to be totally honest with you, there is no cure for it. However, homeopathy has certain kind of benefits for muscular dystrophy where we can slow down the progress of the disease. And I want to share and I have many cases of muscular dystrophy. I want to share with you one of the cases. This is a case of muscular dystrophy, 4-year-old boy. And if you see, the CPK levels was 37,000 when I saw him first time. Weakness, paralysis, unable to move, extreme pain, been losing weight, tartar in the teeth. So, patient emaciating, not able to walk, not able to sit. About his nature, is very shy, doesn't mix with anyone, many fears. His father calls him as a timid person. Tremendous stress for him. So, mother's history during pregnancy, nothing specific. She is a very simple lady, but she also used to take a lot of stress. Now, in homeopathy, it is important to understand the person, the child's basic nature and temperament. One of the main things that the father said, that he sleeps in a very weird position and does very strange things. He really likes fried food, chicken lollipop, he likes a lot. Based on this, in homeopathy, we try to analyze in depth. And when I analyzed, I used a repertory, it is called as Fatak repertory. And on analysis, one of the remedy that came up was plumbum. You can see her craving fried, shy, attitude assume bizarre, tartar teeth, sleep in odd position. On this basis, I give plumbum 200, one dose every month. And I followed up every month. And I want to show you a follow-up at the end of 10 months. And you can see the CPK levels have come to 8,400 from almost more than, you can see the previous reports where it was 37,000. So homeopathy can really benefit cases of muscular dystrophy. All parents there, you have to find a good homeopathic physician and start homeopathic treatment, someone who understands the person in depth. My clinic is in Mumbai, in Dadar. You can write to me if your child has this disease. I will help you out. Keep in touch.